right, we know that a lot of companies are working on vaccines to deal with the coronavirus. What surprises a little bit when a big name like Johnson & Johnson says it's ready to do human trials for its own vaccine in late July. So that's a lot earlier than expected. The read on all of this and the promising potential offerings out there, Dr. Louisa Petrie, the board-certified cardiologist and assistant clinical professor of cardiology at the Mount Sinai School of Medicine. Doctor, good to have you back. Do any of these, Doctor, hold more promise or curiosity to you, or is it still too early to tell?
Neil, there are a lot of reasons to be optimistic about at this point. We covered this before. And phase 3 trial, it's already a very advanced stage in this process. But as we said, to develop a vaccine, you need to follow a linear sequence. You have phase 1, phase 2, phase 3. And this stage would not start unless we have good preliminary data from the prior stages. So right now we do have 3 front runners, and the U.S. government decided to work in conjunction and fund and start 3 trials by July, human trials. And those are meant to have at least 30,000 subjects, and it's going to be with placebo. So that's great news because they are pairing up, they are focusing manpower and resources to develop this vaccine faster.
Doctor, you know, we've heard about 14 states that have spikes in virus cases in the middle of their reopenings. I guess none serious enough to stop those reopenings or even slow them. But what do you think of what you've heard and seen?
Those numbers are definitely concerning for healthcare community. And it's very simple. The more you put people together, more cases you will see. I do think each place has to take the numbers individually, and you have to open staged up following those markers we have and where the benchmarks are complying with the CDC guidelines.
What about average Americans who you've seen a lot of them thronging together for these protests? They feel that's their constitutional right. They're doing that. I get that. But certainly it's going to lead to a spike in cases, right? I mean, these are hundreds of thousands of people across the country, dare I say across the world, who have been, protesting the arrest and subsequent death of this guy in Minneapolis. And I'm wondering, the George Floyd death notwithstanding, are you worried that the protests to address that are going to lead to a worsening in the number of cases, not only in this country, probably especially in this country, but across the world?
Absolutely, Neil. These are 2 crises that, unfortunately, they intersect and they can make each other worse. Because if we look at those images, there are all these large gathering, people are in contact, and already there are a few cases reported to be linked to the mass protest. And it's just going to get a little worse as people do not comply with the social distancing.
All right, we'll watch it very closely. Doctor, thank you very much for all your hard work. Just, looking after us, that's no easy job there. Or taking certain anchors' questions, no easy job there. Dr. Petrie, thank you.